this syndrome will go in detail and talk about what are these syndromes and what are the cause of these syndromes. So those are the cause: increased bilirubin production, reduced bilirubin uptake by the hepatic cells. This may lead to increase in free and conjugated bilirubin, and then results. And this one, if there is a problem is secretion of bilirubin into bile canal occurring, or if there is intra or extra hepatic bile duct obstruction, then this results in conjugated bilirubin level. So once the bilirubin is conjugated, and then it's not being excreted due to maybe to the bile duct problem or due to the hepatic bile duct problem such as obstruction, then this will result to elevation of conjugated bilirubin. So this is the detail. So what is the cause of unconjugated bilirubin? First is hemolysis. Once red blood cells are being destroyed, so the dry it will be the bilirubin will be increased, of course. So this is also decreased hepatic uptake. Several drugs have been. So the drugs also may participate in increasing of unconjugated bilirubin. For example, this is in this figure here. So once the bilirubin comes and a drug may block, so once the for example, the drug which are responsible for inhibited the bilirubin uptake by the liver, here there are example. For example, novobiocin. This drug will come here and bind here and prevent this indirect bilirubin to enter the liver. So once the small amount of this enter, it will be conjugated by this acid gluconosyl transferase enzyme, and then continue the process. Once this bilirubin is not conjugated, and then to take to it's bind to iodine diphosphate gluconic acid and be conjugated by it, and then be released from the bile duct. So the neonatal jaundice, this will occur in 50% of newborn. So because their liver is not able to conjugate the bilirubin, and then the bilirubin will again return in the blood circulation, and they appear on the skin and eyes. So this also may due to rate bilirubin production increase due to shortened lifespan of RBC. So same like here. So a genetic disorder due to the mutation of multi-drug resistance associated protein. So this protein, if there is a mutation in this protein, then it will lead to Okay, class, let's continue. Okay, then let's say let's see what is intrahepatic and extrahepatic bile duct obstruction. So the problem may be intra or extra. So if it is extra, then there is obstruction of cyst duct of common bile duct, cholesterasis. Actually, this term, if you see this term cholesterasis, cholesterasis, it means it is any condition in which the flow of the bile from the liver stop or slow. So if there is a slow or if there is stoppage of the flow of the bile from the liver, and then we call it cholesterasis. So uh, this may be caused by the obstruction of the bile ducts, or this obstruction cause a backup and a reabsorption of conjugated bilirubin, which will result increased blood level of conjugated bilirubin. So neonatal jaundice. So neonatal jaundice may be caused by different causes. For example, in the case of hemolytic diseases, in the case of increased red cell mass, in the case of galactosemia, hypoxia, this the liver will not be able to conjugate the bilirubin, and then the bilirubin will return to blood circulation and reach the different organs, including eyes and the skin. So and then the bilirubin will appear in the skin or eyes. So the yellow color. So it may be also due to conjugated bilirubin. So if there is a bile duct obstruction, if there is infection of bacteria or viruses, if there is a chromosomal infection, chromosomal problem, like a genetic disorder, or vascular abnormalities. So, and then let's talk about this liver enzymes that also helps in liver metabolism, or that helps, in liver activities. For example, alkyne phosphatase. This is a non-specific marker of liver disease. It's found in decreasing order of placenta, kidney, bone, and liver. So it has lifetime of 3 days, and the normal range is value between 40 to 125 unit per liter. So the moderate elevation of this is observed in infection and the alcoholic hepatitis and the hepatocellular carcinoma. So this is the moderate elevation. If it is maybe beyond 225, like it is, for example, 150, and this you may think that maybe there is infection, maybe there is a alcohol abuse, or maybe there is a cancer. So the alkyne phosphatase slight or moderate elevation, I told you that you may predict something like hepatitis or infection or alcohol. But if it is high elevated from 3 or to 10 times, then you may think there is an extra hepatic barrier obstruction. So there is duct obstruction or intrahepatic cholestasis. So the bile flow is not uh, uh, is slow or is not or is stopped. So those are the causes. Another enzyme is called gamma glutamyl transferase, GGT. It's present here proximal renal tubule, in the liver, the pancreas, and the intestine. And this is in serum is from the liver. If it is high, and then you may suggest that it's due to the liver problem. So the normal range is value between 10 and 30. So the moderate elevation, you may think there is infection, viral infection, or cancer. If it is increased, and then you may think that it is alcohol abuse. So this is high sensitivity for alcoholic abuse. So for people who take a lot of alcohol, this enzyme is always high. So there are other enzymes that are called transaminases. Transaminases are the alkyne aminotransferase and the aspartate aminotransferase. Those are the enzymes that are produced by the liver. They are also a good indicators of liver diseases or liver problems. So, for example, this aspartate aminotransferase, it's a maker of hepatocellular damage. High serum level of this enzyme, it is present in case of chronic hepatitis, cirrhosis, and the liver cancer. Another enzyme is called alanine aminotransferase. So this alanine aminotransferase is more specific in liver than alanine aminotransferase because alanine aspartate aminotransferase, it can also be found in heart. So it's during heart infarction, during heart muscle disease, this enzyme may be also elevated. Or during other muscle diseases, this enzyme may increase. So the moderate elevation of alanine aminotransferase, it is mainly in alcohol, hepatitis, and the minor elevation of it is in cirrhosis, hepatitis C infection, and non-alcoholic, non-alcoholic. So even before clinical sign appears, even before any sign, if you test someone, you may get or may see that this enzyme is elevated, so or decreased, or is increased or decreased, depending compared to the reference range. So this means that this alanine aminotransferase, it may be increased or decreased without showing any sign. So the normal value does not always indicate absence of liver damage. That's why one test is not enough to assess the liver damage. So you have to do a different. lactate dehydrogenase. So this lactate dehydrogenase is found in the kidney, in heart, and in red blood cells, and also mainly in the lung. And it's mainly is enzyme in liver, of course, and in muscles. So the name reference is the output is 150, and yeah, it is vetted in hepatitis. Another one is nucleotidase. Nucleotidase, interesting membrane protein present as coenzyme in a wide variety of memory cells. It's an indicator of liver damage also. Enzyme activity elevated in liver diseases, including liver cirrhosis. So this enzyme is elevated also in the case if there is a liver cirrhosis, this nucleotidase will be elevated. If there is a chronic alcoholism, is in the case of cancer, in the case of biliary diseases also. Thrombin time. Prothrombin time. Actually, the prothrombin time is test that is done to assess or to check the coagulation. If the blood is able to clot. So it's this test. It is done to measure the clotting time of the blood. Depending on the plasma concentration of clotting factor synthesis by the liver. So you know that for our blood to clot, firstly there will be the action of clotting factors. So the clotting factors are protein that are made by the liver. So if liver is not able, or if there is a problem, if liver has a problem, and then it will not be able to produce clotting factors, which means that your blood will not be clotted in case of hemorrhage. For example, if you had an accident and then your blood doesn't clot, it means that there is a liver problem. For people who has liver diseases or liver problem like cirrhosis or others, if they make an accident, or if there is they lost, if they make an accident, then the blood will not clot. Sinzi nawe mubyumva, abantu bafite ibibazo bya ibibazo by'umwijima bya liver, umuntu urwaye ufite cirrhosis, umuntu ufite hepatitis igeze kure, umuntu liver nyine itafite ability yo gukora amaproteins. Nabwiye ushobora kureba amaprotein ashobora gukora menshi, harimo za albumine, harimo n'izindi. Ariko muri proteine liver ikora harimo proteine zitwa clotting factors cyangwa amaproteine de coagulation. Amaproteine ayatuma amaraso clottinga, amaraso afata. So urabona nk'igihe wakoze accident cyangwa igihe cya hemorrhage, amaraso yawe ashobora ushobora nyine kuva. Kugira ngo amaraso afatane, kugira ngo ahantu wavaga hafatane, nuko cya gisebe gifatane, nuko haba harimo zia protein za clotting proteins or clotting factors, izo ziza zigatuma habaho gufatana. Izo rero zikorwa na liver. Umuntu ufite ikibazo cya liver, izi protein ntago zizakorwa, nizidakorwa azagumya ave. That's why in lab cyangwa se in case we want to check if the liver is working properly, we measure the prothrombin time. Prothrombin time is also a coagulation protein. No, prothrombin is a coagulation protein, activated one, which will be transformed to the thrombin. So we will check this protein. If it is good, then it's okay. If there is a problem, then to indicate that the liver has a problem. Another thing for the liver, also there is a vitamin. Vitamin K also helps in coagulation. and it's synthesized by the liver. So we may also check the level of vitamin K. Is it that okay?
Yes.
Okay, good. If you understand, then let's continue. So those are also other enzymes that are evaluated or that are assessed or that are measured to check the capacity of the liver. For example, this ceruloplasmin is serves as a is also called ferroxidase, which is involved in the conversion of ferrous ion to ferric ion. Actually, this ferrous ion is dangerous. It's like it's toxic. So it has to be converted to ferrous ion, to ferric ion. If the liver is not able to synthesize this enzyme, so if the liver has a problem, it will not be able to synthesize this enzyme, which convert ferrous acid to ferric ion, to ferrous ion to ferric ion. So then the ferrous ion will be released at high quantity, and then it will cause intoxication in the liver. It will cause problem. So there is also Wilson diseases. This actually this decreased in of this enzyme, it will lead to Wilson disease. So if this enzyme is not synthesized properly, and it will lead to accumulation of ferrous ion, that we call Wilson diseases. So the urea synthesis, we learned about urea, and patient with Still's disease may also the concentration of urea in plasma. The patient with liver disease have an impaired ability to metabolize protein, nitrogen, and so we learned about the nitrogen and about the protein, and so the patient with liver diseases, they don't have ability to metabolize this protein and nitrogen. So the tumor makers are also tested that the tumor makers, they are protein that are there or that are raised, and this may indicate that they may be a tumor. That's why I call it tumor makers. So in the lab, we may measure these tumor makers to assess whether someone may develop a tumor. For example, the one called alpha fetoprotein. If it is increased, then you may predict that the person may develop hepatocellular carcinoma. You may also measure CA19-9. This CA19-9 is mean cancer antigen 19-9. This also, if it is increased, and then you may think or predict this person may develop a biliary tree tumor. Okay, yeah, and then the gallbladder. So the gallbladder, the main problem with the gallbladder is acute cholestasis or cholesterasis. I think you know what is cholesterasis. Cholelithiasis or cholestasis. Actually, these terms are a bit complicated to pronounce. So this cholestasis is any condition in which the flow of the bile from the liver stops or slow. So if the flow slows or if the flow stops, then it is called cholestasis. So for this one, you will measure aminotransferase. I taught you about the aminotransferase, like alanine aminotransferase and aspartate aminotransferase. You will also measure the bilirubin. So how much the bilirubin eliminated, serum amylase, and so on and so on. So this is normal liver function test. Actually, this map or this figure is indicating how the normal function test. So once the aspartate aminotransferase, and you check the RNA, and you come here, hepatocellular diseases, normal albumin. Then if the albumin is normal in hepatocellular disease, if albumin is normal, then there is an acute hepatitis. If there is a decreased albumin, then there is a chronic hepatitis. Here it is in hepatocellular diseases. So in virus diseases or gallbladder diseases, the normal albumin will indicate acute cholesterasis, because in case of acute, actually you cannot, the albumin is normal, so there is a normal function. But if the albumin decreases, then you may think that there is a chronic cholesterasis. So you will do the ultrasound to check to see what is the problem. Is there obstruction of the bile duct? What is the cause of that obstruction? Are there the stones? Because the accumulation of bilirubin, for example, they may cause stone in gallbladder or bile duct. So those stones in bile duct may lead to obstruction of that duct. So that's why we use ultrasound to check whether there is a stone. This bile duct may be blocked by intestinal nematodes, for example. Schistosoma. You block the bile duct. Okay. And this blockage of the bile duct will lead to chronic cholesterasis. So you may use ultrasound and or also percutaneous cholangiography. So increase serum bilirubin. I talked about this. Yes.
I would like to help me understanding more the previous slide on those abbreviations. I'm not understanding them.
Which one? This one?
Yes, those abbreviations which has been used.
Okay. Actually, here they were talking that you remember those alanine aminotransferase and the aspartate aminotransferase. They are normal. They are no, not same. Actually, this one also is confusing me. Okay, let's see what. Me also, I was thinking that they are aspartates. Yeah, they are aspartate aminotransferase. Is right? Actually, they are aspartate aminotransferase and alanine aminotransferase. Okay. You understand?
Yes, what does it mean to say that greater than 3 times URL?
Let's again check what is this URL. Actually, This URL, they are not giving me the meaning. Actually, I'm also not getting the meaning of this term, of this abbreviation. Let's have time and try to find what is this. Also, me, I'm confused with the URL. But what it means is that once is elevated, it will cause to hepatocellular diseases if it is greater than this one. No, yeah, sure. Because this, it may indicate liver. One of these may indicate liver disease. Another one may indicate other muscle diseases, other organ diseases. For example, this aspartate aminotransferase is for liver diseases, and this one is for bile duct diseases. Okay, so these two, if one is elevated in bile duct, another one will be less in. If one is elevated in a gallbladder or the bile ducts, another one will be less in a liver. If one is high in liver, another one will be low in the other organ. You understand? So that's why here it is elevated. It's greater 3 times to this term. This one I don't know why what do you want to say here, but here is less. This one is less, and this one is high. Actually, this is the meaning. Even though this the last one is confusing.
It is
No, I got it. This is upper reference limit.
Yes.
The upper reference limit. Okay. So this also the last slide. So does anyone also have a question? Anyone else? Okay. So if no one has a question, then let's stop class by here. I think maybe this is the last session, or someone on maybe last session, or the last one I give it to you as assignment. Dr. Annette may come and teach you the one topic. If not, I will teach you myself, or I will give you it as assignment. Is that fine? Is that okay with you?
No, teachers.
Hmm?
It is better when you teach.
It's better when I teach. Okay. So I will find time by next week, and I teach you about that. If Annette is not available, if Dr. Annette is not available, because she might not be available. If she's not available, then I will find time and teach you that chapter.
Thank you.
Yes. Okay. So have a good day.
It's better when it's you.
Hmm?
It will be also fine if you are the one to teach.
Okay, no problem. I will find a way. Yeah. Actually,
Assignment
this
is also an alternative.
assignment is also an alternative. Yeah, I will teach you and then give you an assignment. No problem.
Thank you.
Yeah. I found this online class challenging, but there's no other way, because they told me that you cannot put more than 100 students in the one classroom, and also GACO student must attend. So even though this class is challenging, but there is no any other alternative. I will give you notes. Try to go through the notes and try to read different books. I will talk with CP if they are if the time for the cut. So did you do the cut with the Everin or not yet? Okay, I will talk with Sepe. Sepe, by next week, come to my office and we discuss about the cut. Okay? Have a good day.